All right, now we're going to do the lung assessment, and I'm going to ask questions about any lung disease, lung issues, but I already asked those questions in the cardiovascular assessment because they kind of go together. So I'm just going to begin with my inspection. The first thing I'm going to inspect is the anterior-posterior transverse ratio. So this is the transverse from shoulder to shoulder. The anterior to posterior, that's the front to the back. So this way is 1 to 2. So anterior posterior is a 1, transverse is 2. So my anterior posterior ratio is 1 to 2, to transverse ratio is 1 to 2, and that's the normal finding. My breathing effort is easy, unlabored breathing, no use of accessory muscles noted, no signs and symptoms of cyanosis, and the skin color is normal for ethnicity with no cyanosis on the fingers or mouth. Okay, the next thing I'm going to assess is the breast. So you're going to inspect the anterior chest for the breast. The size is equal. There's no masses noted. There's no redness, no drainage from the nipples. Okay, next we're going to inspect the posterior back. So could I have you swing around to the other side? I'm going to inspect the back and look at the skin color and for any lesions, any bruising. I'm going to look at the sacrum area and also inspect that area for redness, wounds, any swelling, edema, bruising. None of that is noted. So after inspection, I'm going to do palpation. I'm going to palpate for pain and tenderness. Any pain or tenderness in your back? No. Okay. And then I'm going to do tactile fremitus. Every time I move my hand, will you say 99? 99. 99. 99. 99. 99. 99. 99. 99. Okay, equal vibrations are noted bilaterally. Vibrations are strong. And now I'm going to do symmetrical expansion. I'm going to place my hands on the back. Can you take a deep breath in? Okay. Symmetrical expansion is noted bilaterally. Now I'm going to percuss the 9 lung fields. I'm going to begin up here. That's 8 and 9. Okay. Thus, percussion and resonance was noted in all lung fields. Now, the next part of the exam is to auscultate. Every time you feel me move my stethoscope, take a deep breath in and out through your mouth. You're going to listen for the full inhalation and exhalation with the diaphragm. Okay. The client has clear lung sounds bilaterally. There are no crackles, popping noises, no wheezing, high-pitched musical noises, or stridor, high-pitched crowing. When I listen to the lung sounds, you'll note brachial or truncal up here. tracheal, bronchial or tracheal, bronchovesicular, and vesicular in the lower lobes are the normal lung sounds. Okay, next we'll do the anterior chest. With the anterior chest, you're going to complete your inspection if you have not done that, and then we're just going to percuss. And you could go all the way around to the sides. Okay, so after percussion, you're going to auscultate. You'll take a deep breath in through your mouth. Could you hold your breast up, please? Okay, and this side. Okay, so you'll have to have your patient elevate their breasts, or you can do it with the back of your hand in order to get the lower lung fields. So after we auscultate the chest in the front, then we are done with the respiratory lung assessment.